announced that South Africa were now entering a second wave. A criteria was formulated by our scientists and modeling teams. As it stands now, as a country, we now meet all those criteria. It also important for us to highlight that 4 provinces, that being Western Cape, Eastern Cape, KwaZulu-Natal, and Gauteng, are the key drivers of this new wave. Of this criteria, we look at the number of tests done, we look at the positivity rate, we look at the number of positive cases as well as the percentage positive. And then we look at the numbers of people who are admitted, and we look at the numbers of fatalities. All of this together must show an indication of an increase, and this on a week-to-week over a 7-day period. As we compare that, we then conclude that there's an increase. Up to the past week or so, we have actually had an increase in mainly Eastern Cape and in Western Cape. There were specific districts which were specifically affected. But now we are indicating that the numbers are increasing to involve more provinces. In fact, as of today, in terms of the numbers that we have got, the increases are shown in about 6 of the provinces. And that's why it's important for us to now recognize that this now is a second wave. The majority of the new cases are from Western Cape, and that is 30% of the positive cases today in the 24 hours are from Western Cape, followed by Eastern Cape, which is at 24%, then KwaZulu-Natal, which is 23%, and Gauteng province, which is 17%. These together are indicating the provinces that are driving the numbers that are going up at this point. Free State, Limpopo, Mpumalanga, and Northwest each account for 1% of the new cases respectively. And of course, Northern Cape even accounted for less than 1%. It's important to make this distinction because since the end of September, we had actually seen most of our numbers coming down to as low as around 1,000, just under 1,000. But now the numbers have started increasing. They first moved to about 2,000, but now they have moved much higher than that. It's important also to highlight that today we've breached the 6,000 mark in terms of new cases, and the total new cases identified are 6,079, which are giving us a total of 828,592 of cumulative cases today. If we go through the provinces, still the highest number of cumulative cases would be Gauteng, Western Cape, Eastern Cape, and KwaZulu-Natal. But we're looking at the day-to-day increases, which is where the concern has come from. There are other seriously concerning issues which I need to bring to the attention of the public. Firstly is that when we were on the plateau, we had actually had a positivity rate. That means for every batch of 100, we had a positivity rate of 10%, and we actually went a little bit less than 10%. So this was the ideal that even our Ministerial Advisory Committee had recommended, that would mean that we are still stable at that level. As of today, the rate is now at 18%. But if you go province by province, you actually find that some provinces are much higher than the 18%, and therefore that's the 18 now is the average for the whole country. That increase is an indication that we've moved from the time when we were at 10%. You'll also notice from the 7-day moving average graph that the increases, there's a rapid increase in KwaZulu-Natal and Gauteng, which is exponential. Now, I'll just try and see if I can show you the graph. It might be possible to show you the graph just to give you a sense of what numbers we are seeing. If you look at this graph, it's basically indicating that activity shows us where we were around June, July, August, where the first peak was. and we had a good lull for September, October, and early November. But if you look at the graph now, it's showing the numbers are already starting to rise. The first two at the top is Eastern Cape and Western Cape, but below them is KwaZulu-Natal and Gauteng. This is the one area that is a major source of concern for us. This rise is showing that it's going to be exponential growth. That means we must expect faster rising numbers with higher peak, possibly than the first wave. In the last 2 days, the age distribution has also showed a different pattern from the norm, and I want to share this with you. This is the peak age at this period is now 15 to 19 years of age group. Now, this is a new issue, and this is what's most worrying. It's believed to be due to a large number of parties involving young people drinking alcohol with no adherence to non-pharmaceutical interventions, wearing no mask and social distancing, and hand and sanitizing also not taking place. We have actually had a report that has come from KwaZulu-Natal from last week, where you could see this pattern is much more widespread than we thought. This inevitably leads to super spread activities, which spill over into the rest of the country as the age group is highly mobile and the majority of the carriers are largely asymptomatic. If this trajectory continues, our healthcare system will be overwhelmed by these numbers. Hence, part of the recommendations that are being tabled by provinces are now looking at how to contain these large gatherings and large parties. And this proper decision will be made by the National Coronavirus Command Council as we look into some of these matters. We'd like to indicate that having observed the trends in the past few weeks, we had already sent a letter to all MECs urging them to prepare their respective provinces for a second wave. The key issues that we have raised for the provinces that they need to ensure that testing turnaround times are as quick as possible to facilitate patient flow, to assess the bed capacities, including recalling field hospital beds and reactivating them, and attending to staff and equipment needs urgently to tighten up monitoring and evaluation and reporting to the national department. It's important as well for us to be able to say, as we're moving around in the various provinces, we're seeing that the pressure has built up in a number of provinces already, and therefore, as we had said earlier, that the second wave is inevitable. I think we will now come to that point. Testing data at this point, 5.6 million tests have been conducted, and 38,200 have been conducted in the past 24 hours. Then previously, we had also indicated that our NICD has migrated to a new system for capturing tests. There's a lot of activity in terms of improving our data at the back office. So we've done total PCR tests. We've given a figure of 5.6 million, but there are new PCR tests that have been done, and there are also retrospective antigen tests that have been done, and there are new tests that are being done. All of this, we're trying to catch up to make sure we don't miss out on anyone who could have been positive. And therefore, the total numbers now that are going to be coming through won't be representing the PCR tests that we have been doing all along. They'll also be indicating some of the antigen tests that would have been done. Regrettably, 135 COVID-19 related deaths have been reported. In the Eastern Cape, there are 56, Free State in 15, Gauteng 16, and KwaZulu-Natal 7, Western Cape 48. This brings the total number of deaths 22,574. We do wish to convey our condolences to the loved ones who have of the departed, and also thank all the health workers for doing all the work that they've done to treat all of these patients. But the recoveries have now stand at 754,658, and this is actually about 91.5% of patients who have recovered. So after visiting the provinces, the various provinces, now our reports are ready with recommendations that come from the provinces, provincial government, from the municipal government, and some of the stakeholders to look at what needs to be done, particularly in these three areas where we've got a belt from Nelson Mandela Bay to Sarah Bartman and to the Garden Route District Council. All of that is now prepared for the National Coronavirus Command Council, and the Cabinet will therefore, after that, take the decision on that. There has also been a request that has been made for all the provinces to, given the experience that they are going through now, to give us suggestions of what needs to be done as we manage the festive season. I think it's important to send a message to all South Africans that, yes, festive seasons are the time for us to relax and enjoy with our families. It's time for us to enjoy, but we now need to understand that we have got a responsibility to enjoy with various restraints. And these restraints are to make sure that it is not a responsible way to enjoy yourself to the detriment of other fellow South Africans. If our enjoyment is going to lead to more people being infected and getting sick and getting admitted into hospital, and even some losing lives, it's not a responsible way of enjoying ourselves. So we need to then be prepared to enjoy a festive season with a difference. And of course, the National Coronavirus Council, the Provincial the Presidential Coordinating Council, and the Cabinet will deliberate on these matters, and then, of course, we will get a proper direction of what needs to be done when the President addresses the nation in due course. At this point, we believe that it's important to make South Africans be aware that the situation is rather concerning, and this is why we thought that we must just clarify some of the situation that we are going through. Thank you very much.
SABC.
Minister, this is Crisalda Lewis. We're live in the Full View studios here at the SABC. I'm hoping you can hear me. In light of what you have announced to South Africans this evening of entering the second wave, is there a likelihood that South Africa could revert to a stricter lockdown before Christmas?
I think we should take all the plans and the proposals that are coming from the provincial governments and the district municipalities and the various stakeholders, so that we table them for consideration by the National Coronavirus Command Council and Cabinet, and therefore decisions get taken at that level. Without being able to know exactly what level of restrictions, but I think it's important for us to be able to say that there has to be some way of encouraging, more responsible behavior. And there must be a way of how we protect South Africans from, a kind of conduct that is showing, a lot of complacency. So we need to really focus on those containment measures that we have always preached about: use of masks, the use of distancing and sanitizers and so on. And of course, once there's all of these issues have been tabled together, we can then give you a much more definitive answer in terms of what we see as the best way to go forward. But that will be after the Cabinet has deliberated, and of course, the President having given the address, then we'll be able to get a very clear direction.
Just very quickly, I know we only allowed one question. You're about to go, Minister. Do we know when we'll get that answer? All right, the media all being allowed one question each to ask the Minister of Health here in South Africa, Dr. Zweli Mkhize, announcing to the public this evening that South Africa has officially entered its second wave. There'd been lots of speculation about this over the past a couple of weeks due to the rising number of infections in the country. South Africa recording over the past 24 hours its highest number of new cases of 6,079. The breaking news at this hour is that, of course, South Africa officially entering that second wave, and the minister indicating that he has also told MECs in the provinces to prepare for the second wave. Him also indicating that there are quite a number of issues at this particular stage which are of concern to him, of significance as well. If you look at the age gap, where there's now a great concern, the age distribution also showing a different pattern to what has been the norm. The age group of 15 to 19 years shows the highest number of cases over the past 2 days. Now, that's certainly of concern. The minister also indicating this is due to a number of parties that we've seen being held in the country. We've seen these super spreader events as well, the rage super spreader events that government had also announced over the past few days, calling on all those who had attended that party to also come forward and to get tested. If we look at the numbers that we're talking about at this particular stage, the minister saying everyone needs to take responsibility for this particular issue. The provinces are seeing significant increases, the Eastern Cape and the Western Cape, the numbers. I think we need to go back to the Minister of Health at this point.
We don't necessarily fully understand, but we believe that there was a huge contribution from that behavioral change. What I think is important at this point is to actually re-emphasize the need for behavioral change, that complacency is not going to help us. Fatigue on COVID fatigue, where people think that, well, it doesn't matter anymore, is actually going to matter. And I think that our focus has to be about how do we, strengthen the behavioral change in all the countries that they've been able to assist, that have been able to reduce the spread. They were assisted by the behavioral change. And so we need to underline that it's a very, very important issue. And of course, additional measures are going to be out for discussion. And so when the cabinet has concluded, the president will announce all the issues that would have been deliberated and taking into account all the contributions that have come from our health workers on the ground who are overloaded, the support that is needed for them, as well as the comments from traditional leaders, from religious leaders, from municipalities that we have been consulting all along, and provincial government that have sent to us submissions of what they believe would help us in containing this situation. I think that South Africans, as citizens, we need to say to ourselves, let us look at what is it that we can do so that we can embrace, the guidance that we're given, as well as the change, the behavioral change that is necessary, so that whilst we enjoy, we must not endanger the lives of more South Africans, expose them to more infections and expose them to the risk of losing their lives. This is a time when we should really act very responsibly.
Okay, thank you very much, Minister. It's unfortunate we could not get newsrooms through, but unfortunately we do need to let you go. But thank you very, very much for this very important public service announcement. And I do hope that...
All right, that public announcement by the Health Minister, Dr Zweli Mkhize, officially confirming that South Africa has entered the second wave of COVID-19 infections. This, of course, had been speculation for quite some time now. The minister also mentioning that the new cases are surpassing 6,000 in the past 24 hours. Great concern as the country enters the festive season. Quite a number of provinces now. The minister saying 6 provinces also now showing increases. He has now gone to the extent of communicating with MECs in the provinces to prepare for this second wave. Let's get some reaction on this breaking news here on The Full View this evening. Let's speak now to Professor Lucille Bloomberg, who's the Deputy Director at the NICD. Prof, a very good evening to you. Thanks indeed for your time. So does this at all come as a surprise, given the rising number of infections that we've seen in the country over the past couple of weeks?
Oh, it's very concerning. It's disappointing. And we need to urgently try to do everything we can to reduce transmission. And everybody has to take responsibility for being part of this.
Prof, Prof, I think, the next question I think that everyone is asking now following this announcement, all important, by the Health Minister is there a likelihood that South Africa should be looking at a stricter lockdown before Christmas? We're heading towards a time where you'll have a lot of intra-provincial travel, and the Minister has alluded to the fact that 6 provinces are already showing increases in the number of COVID-19 cases.
Yeah, I'm not sure that, a stricter lockdown is the answer. We've experienced huge economic problems from previous lockdowns. I think what is most important is to reduce transmission. And there are many things that are driving transmission, people gathering in poorly ventilated spaces. Some are infected, many are not ill, so they don't even think about COVID. And I think as we go forward, the single most important factor is simple. Avoid gathering in poorly ventilated indoor spaces. Wear a mask, distance, do everything that's possible outside. We're blessed with wonderful weather and good sunshine. It's gatherings in pubs, shebeens, clubs, parties, even at home, that are driving this transmission. And that is absolutely key to address immediately. Masking, distancing, going outside, number 1, 2, and 3.
Yeah. But what do we do in a situation, Prof, where clearly that is not happening? And I'll tell you why I say so. The Minister has also alluded to the new age group in which we're seeing a rising number of infections. And this is the younger youth group where the Minister has also spoken about parties that have taken place. Government has expressed concern about, super spreader events, the rage events that took place. Of how much concern is this? And what should happen now? Because clearly there seems to be a problem. The messaging, yes, you cannot tire of talking about non-pharmaceutical methods of, stopping or trying to minimize the spread of COVID-19. But clearly, somewhere the message is being lost.
Yeah, I think young people, want to have a good time. It's that party time of the year. They don't see the face of COVID. They don't see those with comorbidities, those who are older who do experience severe COVID, get severe pneumonia. Some of them die. It's not a disease that they appreciate is a problem. But they are the source. And these parties are definitely the major issue of super spreading, with people attending them poorly ventilated environments. Some are infected, they cough, these airborne particles circulate for a while, and then they take them home to family and friends who've got comorbidities, people they know. That's exactly what we're seeing now. So we have to cancel some of these events. I think there's so many that we don't even know about.
Yeah.
That we have to get the message through to this group. How you do that? Quite a challenge.
Professor, given that you say that you don't think that a stricter lockdown would be the answer to this, do you think government should consider what is currently speculation, for example, restricting access to beaches? Because what we're talking about now is trying to avoid areas where there would be multiple people who will be gathering, and that's likely to happen at beaches, coastal areas around the country. What do you think government then should do if you say that a stricter lockdown would not be the answer to this?
So I don't think the beaches are the major issue. Beaches, people gather outside. I know some are overcrowded, but that's not where I would go for first. I think it's about doing whatever you can to get people to mask, to understand how it is transmitted, and to not allow some of these super spreading events to take place. That's the challenge, but that's the first port of call. And getting people to wear masks properly, not under the chin, not under the nose, getting them to understand how it is transmitted, and that everybody needs to be responsible in reducing this transmission. Outside, distance and mask, we can considerably reduce transmission rates.
And I guess of greater concern as well, the Minister mentioning that 6 provinces are showing increases. And we know, of course, a lot of inter-provincial travel over the next week, perhaps at the start of next week. You're going to see a lot of people visiting family, moving to different areas to holiday. I guess, the fatigue is quite set in. Is there a concern on your part as the NICD that while we're in the second wave now, the greater problem could perhaps also emerge in January when everyone else returns?
I think people coming from the provinces where the surges are being seen, and I think you've mentioned them, and going to provinces going home to provinces where there's far less transmission, may well take it to those areas. So yes, there are major concerns.
Prof,
let's all be responsible, mask, distance, and be outside.
Yeah. Prof, we thank you very much indeed for speaking to us at such short notice, given that announcement that was made by the Minister of Health, Dr. Zweli Mkhize.